Do you ever just... What the fuck? What was that about? Why would you do that?
The turkey gobbler neck. Oh my God, people hate that. Nobody even wants to say the term, and they sure don't want to have it on their neck. We're going to break it down full throttle. Men's necks, women's necks, the turkey gobbler rod. Biggest thing people want to know is like, how do they get rid of it if they have a turkey gobbler neck?
Yeah, I mean, we hate to pick on the turkey, especially before Thanksgiving. But, you know, the turkey gobbler neck is really when you have excess skin and or fat in the neck. And of course, nobody wants that. They want a nice straight jawline, no platysmal bands. And, you know, there's a lot of ways to fix it depending on your age and what you have. If you have fat in your neck and you're young, 30 or so, you can liposuction it. You can do radio frequency or ultrasound liposuction. But the moment you get jowls and loose skin, it's hard non-surgically to really improve that dramatically. So in the end, you're going to eventually need a neck lift or associated face and neck lift with it, which is a surgical procedure, you know, with the incisions around the ear and then behind the ear and then sometimes below the neck. The turkey necks is, as soon as you see a little gobbler, you got to fix it so that you can prolong doing the big thing, which is the face and neck lift.
So how do you, like if you have just a little gobbler, then what should you do?
Yeah, you can just do it in the office. You do a little liposuction, a little neck in the just in the submental area, sometimes on the side, and you can liposuction it. Sometimes you can even do some radiofrequency skin tightening, face tight, and so that works great for several years because it'll tighten the skin, it'll remove the fat, but the underlying problem is sometimes the platysma, and that needs surgery. And then later, it'll just buy you time so that instead of doing it when you're in your mid-late 40s, you can do it in your mid-late 50s. But in the end, we can't defy gravity because gravity will always supersede everything we do.
And then so you have the skin, and then just under the skin is the fat, and then a little deeper than that is the muscle. Right. And then actually below that, there's also other structures that should become more topics of discussion in many of the facial rejuvenation educational panels and sessions that we all are part of. But so how do you figure out what you need to treat?
Well, you go to a board certified plastic surgeon that's a true expert in the correction of facial aging, somebody who really understands the science of aging and who can tell you what the options are and not jump just into one thing. And to tell you about the non-surgical options, you know, you really need to have the array of choices because in the past, Bill, we just had one choice. That was surgery or no surgery. Now we've got neuromodulators, we've got all these non-invasive techniques, liposuction, you got the whole array of things. And only a board-certified plastic surgeon or a facial plastic surgeon who's a true expert in doing these procedures can give you that array of things honestly. So know before you go and, you know, look at their website, make sure they're credible. And the biggest thing to do is find out if they're teaching others. If they're well-respected and they're teaching around the world and they've written about it, you know that they're a true expert. Remember, everybody's an expert on Instagram and on their website. Very few people are.
All right, great stuff. But if you like this, check out this, the ultimate guide to facial rejuvenation options.